Welcome everyone to the Fireside Chat with Dr. Ozzie Ahmed. My name is Sharonica Barcliffe, and I'm the CEO and founder of the Barcliffe Group. And I'm happy to have my fellow colleague in healthcare quality with me, Dr. Ozzie Ahmed, with us today. Thank you. Welcome, Dr. Ahmed.
Thank you. Glad to be with you.
Likewise. So with everything going on with the coronavirus, we've been inundated daily with updates. We've seen naval ships being used as floating hospitals, currents just increasing. From your perspective as a medical doctor and as an epidemiologist, tell us exactly what is the coronavirus and how is this different from the flu, H1N1, and so forth?
Okay, I think the coronavirus is just one of like 200 viruses in the same family. They're like brothers and sisters viruses. 4 of them cause the common cold that we get, all of us, every now and then.
Right.
And we form immunity to each one of them. It lasts for a few months, goes away. That's why people can get colds repeatedly, because they can get another one from the same family. But all these colds are self-limiting conditions, are easy to live with, just a little bit of inconvenience, if you will, cough and headache and congestion. And then recently, in the last few years, some of the viruses of the coronavirus family that used to live in animals, because a lot of them, other than these 4, live in animals most of their life. Like they have a career just with animals. They don't attack us. Right. And then recently the SARS and the MERS, which is the Middle East Respiratory Syndrome, and everybody's familiar with SARS, which is severe respiratory, acute respiratory syndrome. Right. Both of these conditions ended up being a variation on the cold, but they ended up jumping from an animal to us. And once this happens, it's sort of like our body is not used to forming antibodies, fighting armies against them. And as a result, people get these diseases in a very severe way, and they were associated with huge amount of mortality. Like if you think of MERS, which is the one that jumps off camels and from the Middle East to human beings, the amount of death that it has is about 1 in 3 die from that, like very high.
Wow.
And then you look at the disease like SARS, and the death rate is about 1 in 10. When we look at COVID-19 so far, in the world in general, it's around 3-4 range. Obviously, there are some communities and some areas in the world have worse mortalities than others, have worse death rate.
Right.
And the death rate can be due to a lot of factors, not just the virus itself, but can be related to access to hospitals, access to confirmation of infection, ability to kind of isolate infected people from non-infected people, quarantine, all these things. All these things result in lower or higher mortality rate in a way, because you ended up with a lot of infected people, and some of them ended up being severe cases and some of them die. So I think the family of the viruses we are familiar with as species, as humans, but these new 3 viruses are much worse than the rest.
Right. Thank you for that response. In terms of the global nature in impacting the US, can you explain to us the difference between an epidemic and what we're combating right now as a pandemic?
It's a scale. So when a disease happens in many countries around the same time, then it's a pandemic. So a disease that is kind of happening, moving so fast, spreading so fast in a country, or maybe a country and a neighboring country, like very localized geographical area, it is an epidemic. And when something is a smaller scale even, we call it an outbreak. So there's outbreak in a community or a geography or city, something like that, and
Mm-hmm.
then even in a state. And then after that, when it goes in a larger scale,
Mm-hmm.
then it's an epi, and then largest scale, it's a pandemic. So we have before, historically, ended up having these pandemics many times before. And
Oh,
some of the pandemics, old days, like even the swine flu and
right.
plague and all that, killed like millions and millions of people.
Okay.
And the way that they used to spread in the past, they spread sometimes even in medieval times without us even knowing
Wow.
what caused it. So the actually some interesting things like the word quarantine
Mm-hmm.
comes from quaranta, which is 40. Ships used to, in Italy, in Venice, ships that used to carry different products and go to Venice, they were ordered to stay 40 days in anchor outside of the city.
Wow.
And um, 40 giorni is 40 days.
Mm-hmm.
And 40 giorni, from that came the word quarantine, to prevent ships from entering unless somebody goes on board of these ships after 40 days, which was supposed to be, in their minds, the time to really have symptoms of plague. So they ended up leaving it out there for 40 days and then making sure everybody, the dead people, are dealt with and other sources of infection are kind of cleared, and
Right.
then the ship would come in. So
So,
that's history about it.
right. Thank you for that historical perspective. So essentially what we're hearing is that quarantining is not a new concept when it comes to epidemiology and just the social and economic impacts in terms of globally and locally.
I think what makes quarantine harder in some societies than others is the fact that in Western countries,
Mm-hmm.
we as people are um, very much cherishing our individual liberties and ability to move freely and travel and
Right.
congregate with each other.
Mm-hmm.
When you think about the countries that flatten the curve, so to speak, so
Mm-hmm.
far,
Right.
are countries that the population there are more obedient and follow the rules that are set by a central government for them,
Right.
like most of the Asian countries that really did a great job on control in terms of quarantining people. When the country's central government set certain standards for movement, for aggregating people, for schools, for anything, everybody lived with these standards. If they say wear a mask to everybody,
Mm-hmm.
like if you have 100 million people, they end up all of them wearing a mask same
Right.
time.
Right.
So the amount of either self quarantine or kind of things that impact individual liberties and freedoms, they don't feel bad about it. We feel pretty limited and we don't want to do it, and that's definitely a Western sort of, you know what I mean, I would say fact of life.
Right. In bringing home that point, can you explain to us why is quarantining and social distancing from an epidemiological perspective? Why is that so critical in flattening the curve here in the US? Like why is that the locus of recovery right now?
I am glad you asked this question because I think this virus is very unique. So compare it to flu virus.
Mm-hmm.
Flu virus, a person that's infected ended up infecting one person. So it's a one-on-one transmission. And obviously it needs to go closeness and being, like a person sitting next to you, or you coughed on some surface, or
Right.
shared droplets, shared some secretions. And especially when I say that, respiratory secretions, kind of from your nose, mouth.
Mm-hmm.
And when you compare it to COVID, or we call it now SARS kind of 2 type of bug, when
Mm-hmm.
you compare it to it, we have a 1 to 3 level of spread.
Mm-hmm.
In addition to that, the virus itself kind of uh, replicate itself in passage amongst people very fast. So if you get a very few viruses, they ended up going into your body and immediately get into your lungs and ended up stimulating your lungs in a very bad way, to the extent that your body doesn't know what's going on. And as a result, there's a lot of destruction in the lungs, to the extent that the lungs don't do the right thing that they do every day, which is gas exchange. Like when we breathe in, it goes into the blood. But these air-filled sacs in the lungs ended up being very kind of rigid, and it doesn't move. And as a result, we suffer a lot. So the way that the virus acts in the body and the way the virus acts out of the body in terms of transmission rate and something we call doubling time, which the number of days it takes for like 1,000 people infected to be 2,000, or 10,000 to be 20,000, double. So whatever the doubling time is, if it is a very short period, and from the way I said about transmitting, the person transmitted to 3, then the doubling time is very short. When you have a disease with a doubling time that's very short, and it's highly contagious, and it reproduces itself very fast, and it goes and attacks the part of our body that very important to our functioning, which is breathing. When you put all these things together, it makes the disease a little bit more unique in its impact, and also makes it very difficult to control. And we don't have a vaccine for it so far. We don't have even treatment, so we treat it symptomatically, meaning we treat the symptoms. If somebody comes to you very short of breath, you need to do something about shortness of breath. And really, we are limited in the things we can do to people that are severely infected. So we ended up putting a lot of them on ventilators, because you really can't just give them oxygen by nasal cannula, by the normal way. So we have to put them in a respirator. And because of that, our resources get consumed real fast if we are confronted with a large number of cases. And I think the issue that how would you optimize your resources, whether it is national, whether it's state, whether it's local communities, to really meet the needs in each location. The other thing that you notice from the way the virus spreads is, if you look at internationally or even nationally, we have like 4 countries in the world that have like close to 50% or more of the number of cases. One of them is the USA, which is now have the largest number of infected people, close to 200,000. So out of 800,000 in the world, we have like close to 1/4. Then if you add to us 3 other countries, China, and you add to us Spain and Italy, you have this quadro kind of group of countries that have a lot of cases. But when you go and look inside each country, at least in the United States, we know that if you go state by state, you'll find like New Jersey, New York have the largest impact. And then followed by Michigan, and followed by the 4th state is, what other than Michigan? California. So the 4 states that are impacted in the USA, it has also about half the cases, are these 4. They actually have more than half. So if you even count the first 2 states, New Jersey and New York, they have close to half. So why these states have that? Because of population density, makes transmission easy. And also because of the fact that you have like somebody looked at people that use the public transit system and where it stops, and they found a lot of accumulation of cases at the places that the metro stops or the subway stops.
Public transportation.
And the same way, if I look at Florida, for example, where I live, half the cases are in densely populated areas. They're in Miami, Palm Beach County, and Broward. That's half in Florida.
Right.
So I think there is a case here to say, okay, if you want to limit spread, it's spread in or spread out. So you don't want people to go from these areas, like you hear a lot about people from California and other places going to Idaho and charter a plane and go.
Mhm.
Well, sometimes they take a disease with them too to these
Right.
places.
Hmm.
So you should reduce the influx in, and you should reduce travel out from these hard hit areas by really instituting very strict measures on movement, at least this time. So
Right.
not just internal things within these communities that will reduce the community spread, but the importation of cases to other places. How would you decrease spread to places that don't have the same spread? So that's, I think, a point that a lot of places here in the country are struggling with.
Right. Excellent response. How does the capacity for testing impact recovery? So, not having enough tests, test response time. What can we do in the interim, or how does that impact our current state of affairs when it comes to trying to overcome this pandemic or at least curb it?
I think there are a lot of measures. Some of them are dependent really on public health authorities and the government and all that. But
Hmm.
also there are some common sense things.
Hmm.
So when we go to even to do necessary business, like you go to the store, the grocery store, go to the pharmacy, just observe the normal, reasonable protection methods.
Right.
Don't get close to somebody, keep a distance about
Mhm.
maybe 3 to 6 feet away from everybody, and try to just normal, like, regular things that we are asked to do, wash our hands repeatedly, all these kind of things. But I think the other thing is to really think for ourselves, like, if we start having symptoms and we don't know what these symptoms are,
Mhm.
then we need to self-isolate rather than say, well, I'm young, I'm not getting it, it's a flu.
Mhm.
The other thing is, obviously, as a community or various communities in this country, we should have access or more access to tests that would at least tell us who is the person with a high likelihood, even if the test is not 100%.
Right.
The test that, like, if we have a test that gets us to 80, 70%
Mhm.
uh, kind of knowledge about or success in learning about who is infected, then
Right.
we can deal with these people in a different way. And there is a difference between infection and really disease, because this disease has a lot of symptomatic, asymptomatic people. So
Mhm.
some people say it's up to 40 to 80%
Mhm.
worldwide that they're walking around with infection, but they don't
Without,
show
right.
anything. You know what I mean?
We're able to transmit, right?
Exactly. And they shed the virus very early.
Mhm.
They secreted like day two from infection time, they can start shedding it. And
Mhm.
the incubation period is long. Even if they get infected later, they must not show the infection for 14 days, up
Wow.
to 14 days.
That's 2 weeks.
That's the one that they show infection. So imagine there's one that they don't show it at all.
Right.
So we need to test, we need to isolate, we need to sometimes to quarantine certain areas,
Mhm.
like really restrict movement
Mhm.
in and out. We need to practice common sense stuff
Right.
that everybody should be using. And I think, I mean, so many people talk about hard hit communities and stuff like, but they're talking about them from a treatment perspective. I understand the value of treatment because you don't lose lives and you
Right.
need ventilators and you need this. Yes, but I think we need more common sense methods to reduce spread in these hard hit communities
Yes.
rather than just leave everything the way it is today. You are
Mhm.
free to travel, you are free to fly, you
Yeah.
are free to drive your car, go to a neighboring state. And I think that's the call that I have in mind to national and
Okay.
state and local coordinated efforts. So if we institute something nationally to
Mhm.
say these are the guidelines, then everybody has to live with them.
Right.
And we need to be have the foresight and
Mhm.
as leaders in everywhere at a federal level, at state level, to say let's get ahead of this rather than let's react to what our numbers are showing.
Mm-hmm.
So it's hard to, to think that a miracle is going to happen.
Right.
We need just to get stuff, at
Hunker down.
different levels to the
Right.
extent that it impacts us, it impacts local communities. But
Mm-hmm.
it happens at first at high and then gets down to the level of local communities.
That's very true. In terms of following those measures, from your projection, from empirical standpoint, epidemiology, when can we expect to peak if we're all coming together as a community and following those some common sense measures, if we're self-quarantining and social distancing? What is a mathematical projection of when we would peak or when we can start to see that curve flatten?
Can you ask this again? Maybe I missed part of it.
Well, in terms of seeing that peak of that curve happen, if we were to self-quarantine, do the self-care measures in terms of not touching our faces, social distancing, hand washing, can we expect to peak or have this virus flatten at least? When is a empirical projection of when we can see that happen? Or there isn't one? We just don't know.
I think A, we don't know, but I think B, from just thinking about trying to predict it, I think the bad thing about this epidemic so far, or pandemic, is everybody's susceptible. Young, old, sick, healthy. So that's a very hard thing to say, that when you have everybody, you know what I mean, in it.
Yeah.
So that's part one that makes the predictions hard. Second thing, all these things that are happening, we don't know really how they impact the spread. So we can talk about social distancing as it makes sense, but
Mm-hmm.
how much it reduces the spread.
Right.
Is it 10%, 15, 20,
50. Mm-hmm.
50? I don't know. I think we know from Asian countries that really were very
Yeah.
keen on flattening the curve. They ended up instituting a lot of these measures at the same time.
Okay.
So quarantine, social distancing,
Mm-hmm.
treating people, closing cities completely, putting them under lockdown.
Right.
Um, I don't know, if you take each one in isolation,
Mm-hmm.
how much it contributed to the decline in the
Right.
number of cases. I don't know.
Yeah.
However, I think if you think that we don't do anything,
Yeah.
like, the predictions are, or continue the same path like we are doing it today, which is, I would think, a mosaic, I guess,
Mm-hmm.
of different things happening, different communities, different states, even in the states that are not hit at all or hit very lightly. Like,
Mm-hmm.
I remember West Virginia was like just recently
Right.
hit, like was very at the tail end of the curve in this
Very
country.
low occurrence.
Right. We shouldn't be waiting for these places that are not hard hit and say, all right, just North Dakota, South Dakota, let's be business as usual.
Right.
Act like this.
Mm-hmm.
It's very hard to act like this and expect things to happen, because they will be then New York in another
Exactly.
3 months, 4 months, 6 months, and then we'll have a continuous epidemic, or pandemic. So what happens is, because of the nature of the virus, some people are saying, oh gosh, this is like seasonal flu. It's going to be seasonal, like it's going to go away.
Yeah.
It's not going to go away. All the predictions and learning about the biology of it and the virology, it will be with us forever. It will be living with us. Obviously, because it will be living with us, there will be kind of peaks and ebbs. So you will have high number of people infected and high number symptomatic at some point, and then the curve will go down, but it won't go down to zero. It will go down to, flat line or a baseline.
Mm-hmm.
How bad this baseline is, I think it depends on a lot of factors. What kind of treatments are gonna put in there so we can reduce the number of people that are spreading the infection
Mm-hmm.
by treating them even as an outpatient,
Right.
not like in the hospital.
Mm-hmm.
So that's treatment. And then what will be the next thing? We will have to have a vaccine.
Yes.
So if they have a vaccine, we reduce the number of people that are susceptible or people that will be prone to getting the infection. So reduce them by vaccinating.
Okay.
And then you reduce the number of cases by treating them, identifying, confirming, treating people. So these two things probably will flatten the epidemic curve gradually. No guarantee that will go away completely,
Right.
unless there is a miracle vaccine
Yeah.
that will be 100% successful, which I don't know. You know, most vaccines we know about, even the flu vaccine, it's like 40 to 60% success. So it's very hard to say that all these methods will eradicate it, but
Right.
it will help flatten the curve.
Certainly, certainly great information. For those who are hopping on to our Fireside chat, we have Dr. Ozzie Ahmed joining us today just to speak with us briefly about COVID-19 and epidemiologist perspective on flattening the curve, what we can do as a community to get through this pandemic time. He has written 2 insightful scholarly articles. We will share those links with our viewers after we conclude today. Definitely check them out. They're very insightful, lots of great information with us today. Dr. Ahmed, thank you for joining us today, sharing your time, talent, and treasures with us, with the community. Are there any parting thoughts that you will say or any comforting words for our community during this time?
I think what's going to happen to us is we're going to come out of this stronger.
Yes.
We're going to come out of this victorious over this virus. I think it probably gave people the time to reflect in what's important for them in their lives. I think we many times ended up not realizing there are so many things around us and we never paid attention to them. And I think it's a time really to self-reflect, help others, and think of your impact on the community and on other people that will be really useful at this time. How can we kind of unite as a one group, as a one nation, to win the battle against the virus?
Indeed, indeed. Great words to follow and to take this time of reflection. Again, thank you, Dr. Ahmed. We're wrapping up today, and we're glad that you all were able to join us. Thank you and take care.
Thank you.